Welcome and thank you for everyone joining us at the Cannabis Sustainability Symposium today. My name is Natasha Lannard and I'm the Director of Corporate Development at 1906. And it is an honor and so exciting to be here today talking to you all about microdosing and the health benefits and impacts that it has on the market. I will be your moderator, and just a little bit about me. My background is in the natural foods industry and prior to getting into the cannabis space. And for the last 4 years, have actually been very close to the microdosing topic, being the Director of Corporate Development at 1906. 1906 was actually the first line of microdosed products that were released into the market in Colorado, and frankly, in the industry that also incorporated fast-acting technology. So it's super awesome to be here. You know, at first when Peter had launched the product, he was told that no one would ever want a microdose product because why would anyone ever want to take cannabis if it doesn't get you really high? And it's been incredible to see over the last 4 years that since we've been working together, going from having to explain why to basically having conversations about why not. So it's an honor and a privilege to be here with you all today. And we have an all-star lineup of folks joining us. To kick off introductions, I'd like to introduce Ron Silver from Azuka. He is the founder and chief creative officer of the leading fast-acting edible brand called Azuka. He's also a chef and owner of Bubby's, a 30-year New York culinary institution that also has 6 locations in Japan. We'll have to talk about this later, but I really want to go to Japan now that we're free from COVID. In 2013, Ron entered the cannabis space after learning that there was a void in the marketplace for trustworthy edibles. So true. Ron drew the parallel between culinary techniques and the nature of the cannabis plant, consequently developing Azuka's time infusion technology that solves the dosing, timing, and predictability problems that plague the edibles industry. In continuation of his mission to provide the cannabis industry with understandable, easy to dose edibles, Ron marries his expertise and experience as a chef, business owner, artist, and entrepreneur to create and develop new products and expand globally. Ron is also the author of 2 cookbooks, Bubby's Homemade Pies and Bubby's Brunch Cookbook. Give everyone give a warm Zoom welcome to Ron Silver. Next up on the docket is Dr. Jessica Knox, the co-founder of Doctors Knox. Dr. Jessica Knox is a board-certified preventative medicine physician with 6 years of clinical experience in cannabinoid medicine. Dr. Jessica is a co-founder of several organizations, including the American Cannabinoid Clinics, which aims to deliver precision cannabinoid medicine to patients. Pivotal EDU, which develops comprehensive training for healthcare professionals regarding ECS, endocannabinoid, that's a big one, and cannabinology. Dr. Knox's Inc., a popular ECS and cannabinoid medicine education brand, and the Association for Cannabis Health Equity in Medicine, as well as being the first national medical association for BIPOC, professionals seeking to heal themselves and their communities through cannabis education, advocacy, and application. It's an honor and a privilege to have Dr. Knox on here to be able to answer all of any medical questions that anyone on the panel or any of the audience might have. I will say she does have to leave at 12 p.m. MST, 11 a.m. PST. If anyone has any specific questions pertaining to dosing, if you want to go ahead and throw those up in the chat column now or as we get started, that would be great so we can get your questions answered. Next up, I would like to introduce Mary Brown. She is the founder and CEO of SNJ Consulting at the Ames Institute. She is the Chief Clinical Officer and co-founder of Canvas Therapeutics and Revita Labs. Since 2010, Ms. Brown has been focused on practical applications in cannabinoid therapy, helping patients with chronic and acute illness to improve their condition through the use of CBD, CBG, and medical cannabis. She has counseled hundreds of patients studying trends in data and patient response, allowing her to chronicle the effects of cannabinoid therapy on their health and well-being. The clinical as well as helping guide practitioners and patients in purposeful cannabinoid dosing protocols. She is sought after by researchers from various disciplines and organizations to collaborate on the development of products, protocols, and technology in cannabinoid treatment. Ms. Brown holds a BS in education from the University of Montana, a master's in educational administration from Western Washington University, and her PhD studies have focused on the impact of pharmaceuticals on government funding in the public sector. She's a frequent lecturer and is absolutely an amazing member of this panel, having so much research experience in a field that is new and very much up and coming. Next up, we have Jessica Strouper. Jessica is a registered respiratory care practitioner and a cannabinoid therapist and educator with SMJ Consulting at the Ames Institute. She travels nationally, lecturing at medical conferences and providing education to healthcare providers on cannabinoid pharmacology, supporting them to develop better patient outcomes, pulmonary dynamics, and microdose treatment protocols. Jessica earned her respiratory care license from Washington State and has been involved for 2 decades helping folks in the hospital, emergency, and intensive care units. Jessica has been working on cannabinoid therapy for patients for over 6 years, while also developing protocols to support cannabinoid responses and basically help folks and share her expertise and knowledge of the endocannabinoid system with medical providers. So with that, it's an honor and a privilege to be on the panel with all of you. And I think that we're just gonna go ahead and kick this party off, beginning with giving each of you an opportunity to go around the circle to talk about what inspired you to go into this work. I guess for the purposes of Zoom, I'll go ahead and make it easy so we don't all talk at once, and I'll just go based on the slide. Dr. Knox, would you like to kick us off?
Happily, thank you. And thank you for the warm introduction, Natasha. It's great to be here with you all today. I am looking forward to this panel as well, just to hear from all of the other experts here and their perspective. So thank you. So I am, as you said, a board certified preventive medicine physician, finished that residency in 2015 and almost immediately went into the cannabinoid medicine space, starting in, the medical marijuana clinics here in Oakland, California, where I live. And I started doing that work because actually my parents preceded me in that. So I'm one of 4 doctors in my family. People are often shocked and awed to learn that not only do I practice cannabinoid medicine, but my parents do too, as does my sister. But really it was my mom, Dr. Jessica Knox, who was the first of us to get into this space. She retired from a 35-year career in anesthesia, but is not one to, if you know her, you know she is not one to retire into a life of leisure. So she started working herself in medical marijuana card clinics in Oregon. And started telling the rest of the docs in the family about the work she was doing. And, full disclosure, I was extremely skeptical when she started telling me about, working with cannabis medicine. Like most doctors who are trained in the Western medical model, we only learn about cannabis as a drug of abuse and a gateway drug. So I thought my mom was like losing her mind in retirement. But as she and my dad started telling me about the stories of the patients they were taking care of in these clinics, I had to change my mind and really open my mind to a different narrative because, they were seeing patients feeling better, getting better, improving their quality of life, even if they weren't necessarily improving, whatever clinical diagnosis they'd come to clinic with. Meanwhile, I'm in my primary care clinic managing laundry lists of pharmaceutical drugs, feeling like I'm, beating my head against a wall, trying to keep people out of the hospital and not making anybody feel better. And that's not why I went into medicine. So along with my family, I started learning about why people might be using cannabis to help them feel better. And when you start to ask that question of why, you can't help but learn about the endocannabinoid system, the physiology in our body that cannabis works on. If you dig enough, you also can't help but learn about the history, the real history of why cannabis was prohibited in the first place, and why the war on drugs and all of this like nasty propaganda around cannabis and certainly other drugs as well came to be And ultimately, you end up with a narrative of cannabis is a very powerful tool that we can put in our toolkit to work on a very powerful system in our body. And that system really opens the door to not just cannabis medicine, but other natural medicines and botanicals, mind-body therapies, other ancient and traditional healing techniques. It really opens up a whole new world of frankly much more effective, much safer, and much more tolerable health and wellness care. So that's really what got me into this space. And it's been a roller coaster and incredibly fun and fascinating every step of the way.
Awesome. Thank you, Dr. Knox. Let's go ahead and shoot down on my screen to Miss Jessica Strouper.
Hi, thank you for having me. It's great to be on this panel and love hearing about Dr. Knox's experience of starting into medicine and then going into cannabinoid therapy. So yes, I'm a retired respiratory therapist after 21 years of working in the ER and the ICUs and intensive care. Not only did I hurt myself from intubating patients for so long, that's how I discovered cannabinoid therapy, and then realized being so burnt out, dealing with these patients coming in chronically ill, or being the one that would go in the room at the end of life and seeing the situation and the picture of the patient and the patient's family around them, I just felt like I was no longer giving quality of life to my patients. It was no longer helping them in the long run, or even the patient's family, more importantly. So discovering cannabinoids for myself, I kind of dive deep into understanding the endocannabinoid system and how cannabinoids can benefit patients versus all the Western medicine I've been giving and practicing with. So kind of started going towards educating other healthcare practitioners and getting them on board to understand how beneficial it is for patients. And it's not as scary as they think, and it's not the stigma that they believe. And then going to turning my focus from respiratory to more helping patients understand how cannabinoids can benefit them. And, you know, as we're talking about microdosing, my focus has always been on the microdosing and not just about THC, but focusing on multiple receptors of the endocannabinoid system and how CBD and CBG are just as important to help benefit them in their ailments, and finding that right, whether it's the modality or their optimal dosing, and working with them and their doctors to help their doctors feel more comfortable.
Awesome. All right, cruising down on my screen. Mary Brown, would you like to come on the mic? You're muted.
I'm muted. I'm sorry. I had background noise here. I was trying to solve for that as well. Sorry, everybody. Well, again, as everyone else has said, it's just an honor to be on this panel and be surrounded by such amazing team of experts out there. And, you know, I always use the term experts loosely because there's so much that we're still learning about cannabinoids, and we have so far to go. I got my start. I was actually, as you see, my formal background is in education. And as a teacher 20 plus years ago, we were seeing so many students coming in being overprescribed and overmedicated. And these medications were having an impact in the classroom, on funding. And so as I started to pursue my advanced degrees, I was looking at how can we solve for this? And the benefit of being in Seattle, Washington, we have a lot of progressive parents who even then were interested in trying, you know, pioneering the use of cannabinoids for their children with autism and Asperger's. And so being a cannabis user myself, I understood the potential value of that, but I was skeptical in pediatrics. I didn't have children yet, and I just wasn't quite sure, you know, where that would take them. And being able to converse with these parents and letting them confide in me and monitoring the response from children was life-changing for me. And so when I started to pursue my PhD, we were looking at, you know, alternative options, and being able to connect with the medical professionals in Washington who are willing to explore that was what really drove me to turn my focus on cannabinoid therapy and pediatrics. So, you know, again, this was 20 something years ago. So it was really risky at that point. And one of the issues that I found was that even though we were seeing substantial efficacy with the patients, the parents were not allowed to articulate to the medical professionals what and why. And a lot of the answers weren't out there. You know, the research that has been done on cannabinoids dates back decades, but that research is not relatable to even medical practitioners. So I kind of took it upon myself to dig deep and connect with doctors who were open to having the conversation, ask the questions, the researchers, you know, who were really diving into it as well, and then really try to bridge that gap of the practical application of the research being done on cannabinoids and what consumers and patients were really using. Through that journey, we found there was was an issue with reputable products. So at this time, we didn't have the recreational stores, we didn't have the regulations. And so reaching out and meeting with different producers, processors from a small level and watching that growth and that transition globally really has been a strong passion of mine to make sure that these people understood that what they were making, even with the transition into the recreational market, was going to patients as well. And through that, that really just spurred the introduction of myself with Dr. Sunil Agrawal from University of Washington, who is a pioneer in hospice and palliative care with cannabinoids, as well as Dr. Leanna Standish from Bastyr University. She's the former head of research over there, who has pioneered natural therapies in the United States. She was working on an FDA trial for ayahuasca, which has now taken a turn, but we're still very strongly focused on that. And we are now part of the AIMS Institute. It's the Advanced Integrated Medical Science Institute of Seattle. So we're a full integrative clinic where we work with patients with every type of condition from every age, but we really try to focus on integrating new treatments with their typical treatments and finding that balance. And, it's really difficult to find naturopathic doctors and MDs who are willing to work together for the best needs of the patient. So our role as SMJ Consulting in the AIMS Institute is to provide that information and education to both the medical practitioners as well as the patients and source products for them that would best fit their needs. It's wonderful to be with Dr. Knox on this panel because with her family, some of them practicing out of Oregon, we have mutual patients in the past. And so this is what it's all about. It's about talking about protocols, understanding the new research. As she had mentioned, the microdosing, or I think you had said that, Natasha, that's new to a lot of people. And there are so many quote unquote Google Docs, right, who get on and say, oh, if I have cancer, I have to follow Rick Simpson and I have to take 1,000 milligrams of THC a day. Well, maybe that's what he did for his type of cancer and that's what worked. But, we have to look at the cellular biology of cancers and various different types of conditions and look at what we are continuing to learn about cannabinoids and how they impact, our endocannabinoid system and how that drives and modulates the rest of our system. And, and the dosing protocols, again, that go with it, the ratios of products that are out there. It's very difficult for consumers to navigate that. It's very difficult for medical professionals to navigate that and stay on top of the true research that's being done. So that's really our goal, is focused in education at the practical level. So thank you for having it.
Heck yes. All right, Ron, you want to round us out here?
Goodness, I am so literally overwhelmed to be on this panel. And, I just want to say that all of you it is amazing, Dr. Knox, what you're doing, understanding the endocannabinoid system, and really everybody's experience is so important. And I feel in a way that I am literally the guy who's been in trouble for smoking weed since 7th grade. Nice work, Natasha.
Guilty.
And in hindsight, I've really been an artificial outlaw because these laws are insane and there's really no reason. And so many times I'm sort of having to go back in my mind to a place where everything stopped because of one man's mission to do whatever he was doing, Harry Anslinger being that person. So I'm a chef, and I've been a chef all my life. I like to tell the story of dropping out of 8th grade to wash dishes, and that is a somewhat accurate story. And at the same time, I am super dilettantish about actually learning things. And so my interest in cannabis has been natural and deep and long. My first job out of high school was growing cannabis in Mendocino with a lot of people who dropped out of society and things like that. And I've had a really piratey existence with cannabis. And at the same time, I have been diligent about the medicine and a go-to person forever if somebody needed 500 brownies or something like that. I was this person. And I guess about 8 years ago, I was speaking with friends who were starting to explore what the cannabis industry might look like. And really every single person I asked the question what they thought the biggest problem is in cannabis, it was a controllable low dose edible. And so I really set out to figure that out. It's in my wheelhouse. It's like, you know, I really have a deep understanding of culinary stuff. And I know this sounds terrible, but science is really easy because it's like super steppy. They have all the steps all listed out. You're like going in, if you can figure out the steps, you're good on the science, whereas the culinary is a little bit more esoteric. And I found that sort of, not intentionally, but both of those things have come in very handy with a lot of stuff. And so, you know, the other thing is that I really have, I do study hard about sort of anything in a very undirected way. And I take it all very personally because I don't have an actual education, which you miss out on the filter thing that they give you at the school there. So I start internalizing things. And because of that, I feel that I have a personal relationship with cannabis molecules that is weird. It's creepy almost. But it's handy, and I feel almost in a matrix way that I can go swim around this plant, and the more I understand, the more I can do. And so I'm also very much used to working in a vacuum. So it will be really good to come out of this sort of vacuum that I am in. And Azuka, in the meantime, is taking stuff that is coming out of the lab and really applying it all the time, and it's very helpful. So, you know, my main thing is to try to live in the future, as I've been doing all my life with cannabis, in that, you know, I used to live in a world where it was legal, you know, when it really wasn't. And largely because I'm white and can get away with that shit, I did. And, you know, in other words, I did all kinds of stuff that other people might not be able to get away with. And I appreciate that opportunity. I want to take, you know, build on that understanding and apply it to whatever problems exist. One of the things that is really important at the moment is understanding how to capture all these cannabinoids and flavonoids and terpenes in the edible and make it so that it is an understandable onset time. So that's really what I'm focused on. Whatever I can perceive the problems to be, I'm just gonna dive into that and try to do it in a, not listening to the present conversation as it sits, because I feel that it's undeveloped in a way, if that's at all makes sense. That's kind of who I am.
Great. Roll with that. It seems to be working just fine.
I'm also an artist, by the way. So that's the main thing, is that I think of things in a very artist way. And I guess it does work for weed.
That is amazing. Well, you know, I will say, going into what you were kind of saying about microdosing, what everyone is saying, that I think is really interesting, that's really foundational has always been haunting me in my life. One of my first jobs in the natural foods industry, I worked for Udi's Gluten-Free Foods. And I remember explaining to buyers that gluten-free wasn't a trend, that it was a lifestyle. And I think that when I listen to all of you guys talk, this is, for all of the audience here, this is a heavy hitter. I just want you guys to all be aware, this is worth all of the ducats you spent to have this many amazing people on here, because, you know, I think when you think about cannabis and microdosing, it's like, it's not a trend, it's a lifestyle. And I think that what you awesome human beings are contributing to that is making that a possibility for people where they never had it before, because there was inaccuracy in the dosing, because it wasn't fast acting. In 1906, we combined other plant medicines and nutraceuticals to create very specific functional outcome products. And funny enough, our best seller is Midnight for sleep. 100% proof people don't take that medicine to get high. They take it because they need to go to sleep. And so with that, Dr. Knox, I would like to turn it over to you to kind of talk a little bit about the importance and the promise of cannabis microdosing in the medical community that you work with. And if you have any inspiring stories from your practice that you'd like to share with the audience, I'm sure it would go a long way.
Thanks. Yeah. Microdosing I think is incredibly important. And, you know, from both a clinical and kind of a non-clinical perspectives, you know, sort of non-clinically, just talking about access issues, microdosing is hugely important. You know, we're talking about affordability. One of the main problems that we still have in the cannabis space is people being able to afford the product, especially for our patients. Insurance isn't covering this stuff yet. Maybe it will someday. But for some people, you know, microdosing allows them affordable entry into this market. It's also just more approachable when we're talking about novices or, you know, newbies to cannabis, and they're like a little scared still. There's still the stigma. Microdosing is a very approachable way to start experiencing cannabis and cannabinoid products. There's also, I guess, more clinically, the idea of tolerability. You know, when you're starting with those little micro doses, and I don't know if our audience needs, you know, definitions, but when I think about a microdose, I'm thinking about cannabinoid doses less than 5 milligrams. So it might be 1 milligram, 2.5 milligrams of cannabinoids, very small doses. We can use those really small doses to sort of prime the ECS, the endocannabinoid system. So when people are new to cannabis, their endocannabinoid system has not already been exposed to exogenous cannabinoids, because, right, our endocannabinoid system has endogenous or internally produced cannabinoids, but those exogenous or external cannabinoids are a little bit, you know, novel to the system. And so microdosing sort of allows your ECS to be primed to sort of wake up to the external cannabinoids that you're introducing. And that allows you to be more responsive to those external cannabinoids, but also to start to build a bit of a tolerance to the cannabinoids. So with THC in particular, you know, people are aware of the potential side effects of the, you know, euphoria, which isn't necessarily a negative side effect, everybody. But you know, the people might get anxious or have heart palpitations or racing heart or short-term memory loss. There are some, you know, potential unwanted side effects of THC. But when we start with little micro doses and gradually increase the dose, the body actually builds tolerance to those side effects, so that over time you can have higher doses if needed and be less susceptible to having some of those side effects. And that sort of leads right into, clinically, we speak a lot about the minimal effective dose. The minimal effective dose is the dose at which an individual, whether they're a patient or a consumer, finds the relief that they're seeking without being sort of pushed into an amount of dosing that gives them side effects. So it's that optimal dose. And really through microdosing and by gradually increasing or titrating your dose, you can find that minimal effective dose where you're not overshooting your optimal dose and starting to lose effects or get side effects, but you're at that real sweet spot, which is where you want to be. Some of my favorite colleagues in the space call it the kill zone. And I can't remember what exactly, it's a KIL zone, but it's like the keep it, that's what it is, keep it lit zone. I don't know, whatever. I call it the optimal dose or the minimal effective dose. But microdosing allows us to sort of edge up and up closer and closer to that ideal dose for any particular individual, which can be very specific, right? Cannabis medicine is very precise medicine. We all have a different minimal effective dose, even if we're trying to treat or manage the same concern. So microdosing really helps us as clinicians support our patients in finding what that dose is for them.
That is an amazing connection to the next question, actually, that I have for Mary. As your research in cannabinoids expands, what implications to the medical community are you most concerned / excited about? It seems that there's, you know, a lot around dosage.
Right, absolutely. And I will absolutely get to that question. I did want to piggyback on something that Dr. Knox had mentioned too about patient familiarity, right? It's really, really important for us to provide the patients with tools to where they have the control of the doses themselves. You know, so often we're used to the pharmaceutical approach where you take X amount of milligrams at X time, and that's what you have to deal with. So if someone, even by a medical practitioner, is given the dose of, 25 milligrams per day, they don't understand that if that 25 milligrams is too much for them, they can break that dose up through using a tincture or a different type of sublingual dose to still get their optimal cannabinoid, medication that they need, but it doesn't all have to be at once, right? So there's really a shift. I mean, it's been a paradigm shift in the landscape of understanding and accepting how we view cannabis as cannabis-based medicine, but not really applying all the rules that we have become accustomed to as patients dealing with pharmaceuticals. And then when we also integrate cannabinoids into the concept of polypharmacy, right? We know that cannabinoids potentiate the effects of certain pharmaceuticals. So when we work together to do different types of what we call in our clinic ladder dosing, you can take your optimal dose of cannabinoids, break that up, and take it in certain timeframes with your other pharmaceuticals to make them work better. We do that a lot with a pharmaceutical called gabapentin. A lot of patients are looking to titrate from gabapentin, and it's very difficult. And medical professionals are very reluctant to do a rapid titration down from gabapentin, even at patients' request. So we know that microdosing cannabinoids can really be an effective form of administration when working with different types of pharmaceuticals. So I think that is what we're going to find is the most impact on the medical field, is that when patients are using cannabinoids in their current protocol, whether they are or not speaking with their doctors about it, it is shifting how these other medications are performing. We know we see often in our clinic patients on various types of chemotherapies. When we compare them to cohorts who may or may not be, using cannabinoids or other natural treatments, not cannabis-based, they're having different responses to these treatments. So to me, that's what's most interesting, right? We have all this research that's happening, but what patients are really using and the products that they're using in the, in real life is very different than we're looking at in vivo and vitro and some of, these larger FDA-approved clinical trials like Epidiolex, for example. That's a great CBD pharmaceutical that's been FDA approved. I could talk about the cost expense and availability to get it. That's one thing, but in actual use, it does have implications on other medications. Now, when patients aren't using Epidiolex, but they're going to different products that they're finding on the market, they're having a different response than what the patients using Epidiolex are. So you don't necessarily need 2,500 milligrams of CBD to target your seizures when you're using full plant. So essentially, when you're using whole extracts, you are microdosing some of these other cannabinoids and not even knowing it, right? We just place so much emphasis on CBD and THC that, some of these other minor cannabinoids are even more powerful in microdosing. And so you have these wonderful companies that are now isolating these compounds and adding it back in. So it's fascinating to see and compare the patient groups and how they're responding to medical pharmaceutical cannabinoids like Marinol, Epidiolex versus what they're using on the open market. So I think we're going to see a drastic shift in the impact on the medical community. And we need to educate doctors. I mean, what Dr. Knox is doing is fantastic. And she's in the upper echelon of her group. There are doctors that are interested, but the curriculum doesn't exist. Jessica and I were a part of writing one of the first chapters in a mainstream oncology textbook about the endocannabinoid system, with the docs here at our clinic, because that curriculum really isn't there, and they're not putting the time and energy, nor do they have the time and energy to put into, the true research that's happening. So I think we're going to see a lot of evolution in both markets.
Yes, slam dunk.
Amazing.
Oh, so amazing. I'll have to connect you too with my naturopath. He's a Bastyr grad and he's in Boulder and he has a huge practice. And I think that you guys would love each other. So offline, I'll be sure to do that. Dr. Eric Berninger, love you. You saved my life twice. He's next level. Kicking down to Jessica, I would love for you to give us a little bit on what you've been doing to educate the medical community. I feel like what Dr. Knox and Mary just shared is like education, right? People have to know. And that's the biggest thing that we do at 1906. And I'm sure Ron as well. So if you wouldn't mind giving us kind of an inside look at what the responses you're getting from other doctors to the new research that are coming out, what has been the challenges and the opportunities that you've seen.
Yeah, well, as Mary was just talking about, we just wrote that chapter in that book. So that's helping get the word out there, getting it into school, getting the doctors to learn about it before they're out of medical school. But We go around the country and we do these seminars and we talk to doctors and we go to oncology symposiums or palliative care symposiums, and they come in with the concept of it's just THC. Cannabis is THC and it's RSO, and it's teaching them about the endocannabinoid system. And no, there is so much more to this than just THC, and cannabis is full of different cannabinoids and terpenes. Terpenes are just as important, but it's teaching them that no, we are actually targeting certain parts of the body, different receptors with different cannabinoids. And then we Mary and I in the clinic, we focus again on whole plant and the whole, using the cannabinoids together, not so much isolates, but again with the microdosing. And I call it the happy side effects of the other cannabinoids when you're targeting a certain area, say it's cancer or anxiety. So you may be having a higher ratio or higher profile of a cannabinoid or a chemovar, but you're getting these happy side effects from the other cannabinoids in the plants and them targeting other receptors while you're focusing on a certain ailment. So getting them to understand that, it kind of is a shock and awe to them. And some of them are really receptive, and people are lined up for questions afterwards, wanting to know so much. And I wish there was something I could give them to say, here, this is what you need to study. This is what you need to focus on. But you have to dive deep to get everything out there because there's so much new research coming out. Daily, you have to stay on top of it. But just giving them a little minimal dose of anything about the endocannabinoid system and cannabinoids, they're eager and they want to jump on because, like me, and I can relate to them and say, I remember in the ER, all that morphine we gave, all that, that fentanyl, and the patient was third spacing and the family's crying, we're giving quality of life back. So now instead of me walking into that patient room of seeing this puffy, gorked out patient and the family being upset and that's their last images, now I get to give quality of life to these patients. And I relayed this to these doctors, say, yeah, the last few days they were awake, they were alert, they were holding hands with their loved ones. The loved ones' last images of them was a happy response, even though they knew they were going to pass. It's giving them time to say goodbye and be in the moment. So I can't think that kind of relates to them and they jump on board, but then they also are scared to mention cannabis to their patients. So I always say, that's fine. There's many places these patients can go to. Have them call Mary and I at the Ames Institute or Dr. Knox, or there's many other people you can get out there to get a hold of. You don't have to be the one or be scared of your license being, possibility of getting in trouble for mentioning cannabis to your patient. Give them my card. I will talk to them. And if you're open to it, I'll work with you because I'm not talking about getting off their other pharmaceuticals. I'm talking about using them in conjunction with and integrating our care and making what's best and improving the quality of life for that patient. So they tend to be more receptive than you think. I remember when I first started doing cannabinoids and I was still working in the neonatal ICU, I was scared to say anything to the neonatologist, like, oh, they're going to think I'm a druggie or what, just the concept, the stigma was so in my head that when I started talking to them, amazing how receptive they all actually were and how some of them were all kind of doing little bits on the side, but none of us were discussing it when we're in the actual hospital. It's kind of a fear of somebody finding out that we all know about cannabis and that we may be using it at home for our own ailments and symptoms. So I find that they're much more receptive than you think. We just don't have enough education out there. We need more. We need to incorporate into when they're going to college for the medical license, they need to be in the curriculum and not just kind of out here having to search for it or a symposium that Mary and I are going to. But we're trying to get it in that book, in the chapter, and doing more and more webinars, trying to reach more healthcare practitioners.
Wow, your work in end-of-life care that's cutting edge. And frankly, it's something that I think we all deserve. There's a certain level of art that goes into dying, and I have a personal interest in that. And for you to be taking that medicine and that message to folks at the end of their lives to improve the connection with their families is a big contribution. So personally.
Can I add in on that just a little bit, which is something that was kind of new to me over the last couple of years, not necessarily cannabinoids in hospice and palliative care, but the impact that microdosing in hospice and palliative care can absolutely have. Because again, we're so conditioned to think that, they're not getting relief from a certain amount of THC or medication. So let's give them more. Let's give them more and more. We don't have to sedate dying patients. They can be passing, they can transition and be lucid and interactive with their loved ones. And for me, you know, when I started, I was not a mother, I was an educator, but now I'm a mother of 4, and I deal a lot with pediatric hospice. And again, you know, as Jessica said, just giving that opportunity to give them the quality of life in those final moments is amazing. And that's something that we should really continue to hold our core values, whether we're in the medical industry or the cannabis industry. And it doesn't have to be more, right? You can take their pain, reduce their pain. I'm not going to say take it away, but you can take that pain away. You can take that agitation away during that transition time with minor doses, as opposed to just inundating them. I mean, I hear so much with caregivers coming in saying, you know, I gave them a half a gram of RSO, and, you know, they were still vomiting. And you're saying, because it was probably the RSO that was making them vomit, you know, let's scale way back. And, you know, I know, Dr. Knox, you're looking going, I'm sure you've heard it too, right? Everybody is just taking this information that they're finding online, and with, I'm sure it's given by friends, you know, with the best intention, but let's really look at the science behind cannabinoids and what's available, and, you know, making it, as you said, a lifestyle, right? Prior to end of life. So thanks for letting me jump.
No, that was amazing. That's what we're all here having fun, right? I know, Dr. Knox, that you have to hop in a few minutes, so I wanted to give you an opportunity, and I feel like, Mary, you kind of gave me a good lead on this, is you get on the internet, you see all this stuff. I mean, what are the resources if people are going to get on the internet, which we're all on the internet right now, right? Like, what are those resources that you would recommend that you find to really check out from a science perspective that you'd like to share with the audience?
Yeah, thanks. And I just have to say that in my medical school experience, my elective rotation in palliative medicine was hands down my favorite. That was an incredible experience. I will not spend too much time just bragging about how amazing palliative care is, but I'm so glad that topic came up. As far as resources, you know, as clinicians and probably as researchers too, we always start with PubMed. We go directly to the source of scientific papers. I know that those papers are often not accessible for a lot of people, meaning like in their language. Even for us clinicians, like we have to read those, you know, half dozen times before all of the the scientific jargon starts to make sense. But the amount of research and information that is available is incredible. And it's unfortunate that so many medical providers continue to offer the excuse of there's just not enough information out there about cannabis. That's terrible. We need to stop doing that. You know, it's part of our training to understand how to decipher scientific papers. So we're really doing our patients a disservice when we give, you know, poor excuses like that. So yeah, PubMed is a great resource. Some of the more, I guess, accessible resources, I really like Project CBD. I don't know how other people feel about that, but I think they do great articles. I think they break down complex information in a very accessible way. Of course, Dr. Knox, we try to provide education that's accessible to the common lay person. You mentioned ACAM in my introduction, Natasha. ACAM is our National Medical Association for BIPOC and allies in the healthcare professions, or just healers, because we recognize that people have healing capacity, even if they are not, you know, certified, licensed, whatever, healthcare practitioners. But we're trying to provide resources for people to arm themselves with information and knowledge that they can use for their own health and wellness, as well as that of their patients and their community. So those are some of my favorite resources to direct people to, because yeah, there's all kinds of information on the internet, and a lot of that information is artifact of prohibition, right? Like the more the better, the higher the dose the better. Like that's an artifact of prohibition, when, you know, you were incentivized to get as much THC as you could, you know, as surreptitiously as you could. And you know, it's through these various education efforts that we're going to bring the community to understand, actually, there are many nuanced ways to use cannabis and cannabinoids for overall health, and also for treating specific conditions if that's what you need to do. So I I'm sorry I have to leave early because this has been a great conversation. I thank you for having me. Hopefully they'll let me look at the recording so I can see the rest of what everybody talks about. But again, thank you for having me.
I just want to go on record and say that I have about 43 questions for you, and a couple of other statements.
Oh, Ron, this is perfect because I'm going to turn it over to you for the last question. And then I think it's time to give the audience opportunities to ask 52. I mean, let's crank these questions out, people. Thank you so much, Dr. Knox, for being with us today. An honor and a privilege every time. So with that, Ron, I'm going to pass it on to you to kind of talk a little bit about how and why microdosing in edibles has been such a game changer in the industry. And in the future, do you see other specific cannabinoids marketed through edibles similar to the way that you've seen things done now? Or walk me through what you think in your futurist cap on what you see coming down the line.
Well, first of all, I have to say that this group here it really puts tears in my eyes to hear this conversation. And there are so many things about it that are interesting, just to hear how each aspect of this and you know, Dr. Knox study of the endocannabinoid system. And, you know, I have a theory that there are dozens at least of kinds of endocannabinoid receptors, you know, and so we know that there's two, but I believe that there are dozens, if not hundreds, and the way that this thing works is sort of mind-blowing, and these happy side effects are very, very hard to get one's head around, because each plant, even the same genetics seeds, have different chemovars and you know, there's 1,100 flavonoids and terpenes and 260 cannabinoids all doing something. So, you know, just for the sake of the idea of microdosing, I personally feel that it's the most important part of cannabis consumption. It's not something that I've practiced ever, but it is something that I've seen work for people. And, you know, prior to maybe 1920, 0 doctors had medical degrees. So I'm saying that I've had these experiences where I'm like, this kind of feels like being a doctor, because the person in front of me is dying and I'm trying to help them die better. And I'm like, and you know, like suddenly all of a sudden this invisible, like what I call the doctor wall got all zipped up, and I'm like, okay, here's what we're gonna do. So the microdosing is really important, and trying as a practitioner of thinking about cannabis to understand what dose for what reason, what's going on. It's very mysterious and witch doctory in a certain way at the moment, even though I try to really use practical experience to help people consume cannabis. What I realize is that my function is to provide a toolbox for people to deliver different cannabinoids, or all the cannabinoids and flavonoids and terpenes, in a way that they are finding to be effective for whatever way that they're delivering their medicine. You know, and 1906 is such an amazing brand, you know, really, and this is not a hot air blowing smoke situation. I'm saying there aren't that many brands out there that have any kind of integrity at all. And so I find that the first most important thing for me to focus on is the actual integrity, and to try to understand what's true out of the conversation and sort of what's not true and what might be true. And then just focus in on how to develop the tools so that you guys, or that people who are making or using science, can apply those things and learn about how all of this stuff works together. I feel that, well, the strength of the technology that Azuka has, not to talk about my own product, my own thing, but is the ability to really encapsulate one molecule at a time and to deliver at sort of the smallest particle possible. And I think that if there were those little sort of homeopathic ball things that were like 0.5 milligram each, then you could really dial it into a 1.5 milligrams to go take your test, because the very low dose really helps for memory uptake, and the very high dose helps it so that you can sort of die better. And it's all very, and you know, and all the individual cannabinoids, the THCVs and CBGs, and you know, and even, you know, just understanding how THCA in an non-decarboxylated plant has its own value without any kind of intoxication. And something that I'm very much working on is fermentation and old, not just curing methods, but curing and fermenting and seeing what happens to these cannabinoids under those circumstances. So I think that for me, you know, because of the position I'm in, where I'm under zero pressure, like it does, if I ruin a bunch of pounds of weed, I've never been in a situation in my life where I could just ditch that. You know, it's not something I would have done. But now I really, if I mess up a bunch of stuff, I don't mind, because it's sort of, I feel like I'm really making progress with that too. And then to be able to see the conversation developing, what everybody on this call is doing, really everybody, I find that what I'm doing will be useful. And so I really want to just try to make it so that the smallest dose possible with the most attributes of cannabis and the ability to add other things in, I just want to make the best sort of snap-on toolkit possible.
I love that. And really that's what 1906 aims to do too, right? A toolkit for modern living for high functioning adults. And I feel like the last thing, just because, I mean, it is such an honor to be moderating this panel today. I just am so impressed by the talent that the Cannabis Certification Council, the wisdom that they were able to assemble. And I think before we all part ways, I think something that's really interesting that kind of would be a good tie up for everything that we've talked about is, obviously there's all of these different cannabinoids. And Jessica, Mary, you're out talking to healthcare practitioners, you're a researcher. Are there some cannabinoids that you found that are more effective for microdosing protocols than others?
You want to go, Jessica?
Sure. I was going to say it depends on the person and the individual, because we all have our individualized cannabinoid sensitivity. So it's more of, what are we dealing with? And then we focus on whether it's CBG, I find has had more efficacy on, say, like hormonal migraines. So it depends on what we're treating. They all have their benefits and their efficacy. So you kind of have to hone in to that individual. It's not a cookie cutter. It's like we said, it's not the mLs per kilo. It's not, you know, if you're an asthmatic, you're going to be taking prednisone for this mLs per kilo. When we do consults, we sit down with the patient and we have to find their history and more kind of starting them on a micro dose of introducing to the cannabinoids of the plant themselves. But then we also know if we're focusing on, say, the hormonal migraine or endometriosis, or we're dealing with chronic pain, we're going to focus more towards a certain cannabinoid profile and then microdose from there. But it's really individualized. We microdose all of our cannabinoids. We like to go with more of a whole plant feel, or, you know, the entourage effect. But I can't say it's one or the other. We tend to use the whole plant itself, and it's focused to each individual and finding their optimal dosing range, plus what kind of modality we're going to use with this microdosing. There may be multi-modality depending on the day, the time, what they have, if they have to work, if they're picking up kids, if they're having chemotherapy, if they have to present and their anxiety is up, we're going to, you know, maybe we have a little a little as needed dose for that. And it may be a different cannabinoid than what they're usually taking for their daily regimen. So it's individualized, it's focused on each symptom, ailment, life event. And we kind of try to cover everything with them and hone in a personalized cannabinoid profile and dosing regimen for them. So I can't say it's one or the other, THC, CBD, CBG, CBC, CBN for sleep. We use the whole plant and we use it for the whole patient.
Jessica, I'm going to kind of give a different perspective on that, if you don't mind, only because Jessica's 100%. We use the whole plant and everything she said is spot on. But I think, too, the fact that we're able to have access to more minor cannabinoids now, for example, cannabinoids like CBC, we know is much more potent than CBD and sometimes THC for different reasons. And Ron, as you touched on, we know that there are more receptors in our body that respond to cannabinoids aside from CB1 and CB2. We also know that different cannabinoids respond differently on those same receptors. So we have, cannabinoids that respond to our TRPV receptors. And I mean, we could go on and on. This might not be a medical group, but I think, the fascinating thing about this is to take it back and say, as we individualize all of this for patients, now science is leading us to the time where we are able to isolate some of these other compounds and put them into products like food. Ron, as you're speaking, the phrase that comes to my mind is let food be thy medicine and medicine be thy food. We shouldn't have to wait until the end of the day, and figure it all out on our own to take these products to get relief, right? We can incorporate cannabinoids into our food for better health and wellness. We know, Jessica is phenomenal in her understanding and ability to articulate how CBD, mitigates our inflammatory response. So it's not just turning to CBD to, because it doesn't make us high, it's integrating it. We talk about patients integrating it into everything, you do and you eat so that you stop the initial inflammation prior to when it starts to hurt, right? So I love the idea of putting cannabinoids in your daily regimen or protocol, even before you're hurting, before you're sick, and then being able to fine tune it, like Ron is saying, at minor, molecular levels, or however we want to phrase it. It is just fascinating. So a lot of people kind of push back on, we don't want to isolate and use those because it's not whole plant, but really, if we can enhance some of these other cannabinoids to better microdose, then we're on an amazing path forward, right? We shouldn't just stop because this is what, history has told us to do, is just to keep the plant in its traditional form. I don't want to standardize it, but I want to make it something where we have more access to these minor cannabinoids that are doing such wonderful things for the human system. So
the one thing I want to say, just if I may, the one thing that there's this cycle between sort of, the power that pharma has and the FDA and the way that people try to think about their thing in some phase 2A and B exit scenario, what I would call bullshit. And I don't understand that stuff. It doesn't serve anything except for money. And so really, and then that feeds into this fear, Mary, or Jessica, with education, what you can and can't talk about, who's going to get mad about it. And that really could just be blown up in some way, is my suggestion. But I don't know. I live in a sort of a world where, Azuka has a CEO, and she's an actual grown-up. She would never let me out on my own without a very short leash. But I'm saying that I don't understand all the thinking, but these are the gates you have to get to. But the real fact of the matter is, coming with me into the future for a second, is that all this stuff is working. You take the stuff, you smoke a big fat joint, it's 280 cannabinoids going to work, doing their thing, and that does bring up a sort of patient, sort of doctor interaction that isn't usually the case. The patient's sitting there like, help me, give me a pill, see you next week. And that doesn't really work. This is a sort of, it's a medicine of the people. The people have to pay attention to it. And so, I find it to be really important to get that different thinking out there with people, to not pander to that stuff, even though, that probably doesn't hold water in the real world. I apologize for bringing it up.
No, but no, Ron, I think that's an excellent point. And that's exactly what Jessica's talking about, right? Patients come in and they want, in our clinic, they want, to be given a specific protocol. What do I take, right? And where we're saying it's not that. You don't have to adhere to the pharmaceutical approach. You can manipulate this to make your lifestyle work. You can manipulate this to work for your individual system, right? It doesn't have to be one product over another. But what we find the balance in is that we have to speak the doctor's language, right? Because they're only going to accept so much. We have to put it in terminology where they will understand. Because, as Dr. Knox was saying, you bring a research to a piece of literature to the doctors, right? And from a patient's perspective, they're going to say, hey, this is FDA approved, or this is, being focused on the FDA. I'm with you. That doesn't mean anything to me, right? I know how trials go through and I know how things get pushed through. And we know so much more about cannabinoids. And so, but to have a consumer take a piece of literature and say, well, it told me that Delta-9, targets cancer cells, you have to look so much further into what that research is being done. It's in a petri dish, right? So when these doctors are saying, yeah, I agree, you need, 300 milligrams a day, well, you're only relying on THC there. You're not using the rest of the plant matter. So I hope my message didn't come across skewed, because I agree with you 100%. And that's what I was saying with Jessica is that, we have that perspective where we're working with the patients, and this is the practicality of you using these products on a daily basis, and what works for you. Listen to yourself. You don't get to do that with pharmaceuticals, right? No,
I just want to say I don't think it was skewed at all. I would say that I feel skewed myself.
Oh no!
in that they're to have your feet firmly planted in the reality of today's situation, be able to have a conversation with the FDA or whatever, or investors or anybody else is crucial.
I don't want to interrupt, but we do have
some frustration.
Yeah, this has been. This is making my day. I think something very interesting and something that's super relevant, honestly, with the world that we're all living in today goes into what is there a cannabinoid combination, or are there certain things that you guys are recommending to different doctors or folks that are looking to maybe minimize their use of drugs and alcohol? I feel like the last year has been really hard on everyone, and we've all seen that one of the major casualties of COVID has been addiction, and we've lost a lot of people in this country. And I think it's a really good question. So thank you to the audience member for posing that. Would you mind giving a little bit of detail on how you're applying cannabis medicine to treat those two things?
Sure. So one, this kind of piggybacks on what we were just saying, right? There is no magic dose, right? Because of how cannabinoids work in the human system, it is different. So our approach is we look at a few things, and this isn't anything that we could tackle in 5 minutes, so I'm going to be very broad in my response, is we look at if the patient has had prior experience with cannabinoids, and if they are, how are they using it? Again, like I said, are you using it at the end of, are using, cannabis, or even your pharmaceuticals, your opioids, your narcotics, your drugs, are you using that to escape something? Right? And if that's the case, when are you using it? Are you using it at the end of the day when work has built up and you're just trying to, have those drinks just to relax? If that's the case, what we recommend that they do is, this is where the microdosing comes in. Start out with a minor dose in the morning and continue that so you don't hit that peak during the day where you're seeking that, that escape, right? Whatever you turn to for your addiction. Most often people who have addictive personalities, the use of the drugs falls into a pattern, right? Like I get up in the morning, I take my Oxy, and by 2 o'clock I need more, and I need to mix it with my Halidol, and whatever it is they're using. And then I have my, my bottle of wine at 4 o'clock. So we will recommend that either they do their current cannabinoid protocol, and that they do it about an hour or two prior to when they think that need kicks in, right? Our body is a physiological system. It has chemistry. And so if they are becoming addicted to different types of substances, preemptively taking cannabinoids can take away the need, because that physiological need for the other opioids and narcotics. And then we suggest that they, instead of just giving up what they lean on, is reducing that, right? So let's just say I'm addicted to Oxy and I need to, again, the very basic, my 2 pills every 4 hours, I can't get through my day, right? Well, we know that that's not probably necessarily needed. And we know that that has a negative impact that can increase pain. So if you take your cannabinoids slightly before some of these products, then try taking half of what you would typically take and see if you have that need. So again, it's very individual. I'm not asking anybody to go and combine their cannabinoids with their pharmaceuticals. I want to be very clear, but we typically do what's called ladder dosing, and it's quite effective in getting patients to reduce, their addictive tendencies. But I do strongly recommend that you work with a doctor, a medical professional, because titrating too quickly from your medications can have adverse effects. And when I say medications, I mean, alcohol for some people is a medication, right? Whatever you're leaning on. Jessica, did you want to add anything to that?
No, I think that's perfect. It's mainly about weaning and titrating that balance, because if you come off too fast, there's withdrawals, and then we're right back to where we were and maybe even more. Like Mary said, we usually start with a small dose of introducing cannabinoids in there a little bit before, to slowly start titrating those other medications or drinking or whatever we're doing. As a respiratory therapist, helping people quit smoking was a huge part, smoking cessation. And just for them, that act of going out in that break, that smoking break, or having something in their hand, having them use something else was beneficial in helping get rid of that addiction. So sometimes people, even with smoking, I will help them with the vape pen, just holding it as they would smoking a cigarette. But with the opioids and alcohol, again, it's bringing in little small doses, introducing this cannabinoid balance and bringing down whatever else we're using, whether it's gabapentin or opioids or something else, slowly, not too fast, because that's when you have 2 steps back versus moving forward. So, and working with them, individually, finding out how they're feeling emotionally and physically, because it's not just, like as Mary said, what is it that they're trying to avoid? There's something emotionally there too that they're working on. It's not just a physical aspect of the addiction. There's multiple parts to that: stress, family, anxiety, so many things incorporated. You need to really see the whole patient and work with them through that whole process so they can bring down the addictive medication into a cannabinoid regimen.
Awesome. Wow. To summarize, talk about a Friday fun day. Thank you, panel. Amazing, epic human beings. Ron Silver, Jessica Strouper, Mary Brown. You guys are all a massive contribution to a science, to an industry, to a lifestyle. And on behalf of everyone who's ever gotten high or microdosed, I want to thank you all for participating today and sharing your wisdom and sharing your knowledge, and most importantly, sharing your passion for something that for a long time was counterculture and is now becoming mainstream science. And it's because of folks that are here now, right, supporting the movement and really bringing awareness to what it looks like to, frankly, be sustainable, right? So thank you so much. I hope you guys all have a great day and an awesome weekend. It's been an honor and a privilege.
Thank you
all so much.
Bye.
Having us.